I'm Dr. Kelsey with Premier Chiropractic. I'm here to talk to you today about hip flexors, pain and tightness. The hip flexor, there are 3 muscles, but they attach to your thighs and they help pull up your leg, and they also attach to your lumbar spine. And their main action is pulling up the leg. It's a common injury in runners, also with people that sit at desks all day because that muscle is shortened. And when you sit like this for 8 hours and then you stand up, it lengthens and it's aggravated because it's not used to being lengthened like this. With runners too, the repetitive motion of bringing up your leg higher than you normally do with walking, it aggravates it as well. And also with sitting all day, when you are sitting, your glute muscles are stretched out and then they become weaker. So I'm going to talk to you today about how to stretch the hip flexors and how to strengthen the glute muscles to help try to alleviate some pain that you have. We are going to start with stretches first. So I'm going to show you some static stretches with Dr. Becky here. It's important if you are going to go for a run to do dynamic stretches before a run, or you can do static stretches after, or if you've been sitting at a desk all day, static stretches will be okay. The first one is a kneeling hip flexor stretch, where you just lean forward into the stretch. You start out in kind of a lunge, and then you lean forward until you start to feel. If you are feeling a little bit of a stretch, but you need a little bit more, it's also easy to lean into a little bit different angle because there are 3 different muscles. You feel the difference?
Yep, definitely.
And then you can also, so moving that back leg in and out can affect which muscle you're stretching. And then you can also use a foam roller. If you're a runner, it's vital that you have one of these. They're great for IT band too, which runners will notice a lot. And then you can use it on the hip flexor as well. And then lastly, we're going to show you some exercises to help strengthen the glute muscle to help counter the shortened, strengthened hip flexor. We're first going to start with the fire hydrant. This is a good one for activating the glute muscle. You want to make sure your hands are under your shoulders and then your knees are under your hips. And then Dr. Becky will show you by lifting just that knee up to 90 and then going back down. Then you do 15 on one side, then you do 15 on another. It's not unlikely to feel a burn inside you're not using, just because that's also doing the stabilizing, which your glute muscles are great at stabilizing that pelvis. And then lastly, we're going to show you the bridge. And it's important to keep your heels under your knees, and then so you bridge up. You want to make sure that it's a complete flat bridge. And then you hold it for a couple seconds and you go down, and then you...
And tightening the glutes as you go up, right?
When you tighten the glutes, you want to make sure that you feel the tightness of the glutes. And then you do this about 20 reps as well.
And hold at the top for a few seconds.
And hold at the top for a few seconds when you're really contracting those muscles. And then lastly, I'm going to have Dr. Becky stand. And lastly, we are going to use a theraband, which we have at our office. We hand out to our patients. And we tie it in a circle and we put it around our ankles. We're going to do a monster walk. And basically, you can do it laterally, as she'll show you, or you just go side to side. And this is good for the IT band and the tensor, fascia, latta, and the TFL. And then if you do it diagonally, where you walk forward a little bit, perfect. And then you can also walk backwards.
So you can definitely feel how it works 2 different areas as I'm doing it. Awesome.
The angle one will focus on that glute muscle, and then the side to side one will focus on your TFL. So now you have some stretches and exercises to do if you are having some hip flexor pain and tightness. It's important to know, though, if you are having some hip flexor pain or tightness that's been going on for a long time now, to realize that when it is really tight, it pulls it forward and then you have this increased curve or lordosis in your low back. If that is going on, what happens is this low back isn't moving as it should and the alignment can be off. Chiropractic care is a great method of adjusting this, and putting some proper movement and alignment in your low back might be what you need. We address this in our office and we do some rehab too. So if you have any questions or concerns, feel free to give our office a call.